Well, more than 3 million Americans a year are diagnosed with enlarged prostate, and the condition is called BPH.
For the longest time, finding relief meant having surgery. Here's the good news. There's a minimally invasive treatment option available locally now.
Right, and Dr. Andy Arther joins us from Adult Pediatric Urology and Urogynecology PC. Good morning.
It's nice to meet you, Doctor.
Good morning.
Yeah. I think a lot of gentlemen are going to be interested about this, especially BPH and what we can do about this. But let's back up a little bit and talk about APU and when you opened and a little bit about the clinic.
Sure. So we've been serving in Omaha for over 30 years. There's 9 physicians, and then we have 3 nurse practitioners and 3 physician's assistants. Then we have 2 locations. So there's we have a location in Council Bluffs and then a location in Omaha as well.
Helping a lot of people, and a lot of people do need help. With BPH, let's define it first, and then we'll talk about treatments. But what is it?
Sure. So it stands for Benign Prostatic Hyperplasia, and it's a disease where the prostate enlarges as you get older. So it's usually in men over the age of 40. So people are at risk are basically men, and there can be kind of a genetic inheritance as well. So if your father, your uncle had problems, then you could potentially have trouble too.
Yeah, and I think it's probably a little more common than people think. How common is it?
Oh, there's millions of men every year. So more than 12 million men are seen and treated every year for BPH in the office.
Wow. So. How do you know the early signs there's an issue that you should see a doctor about it?
Sure. So yeah, a lot of symptoms that are very common, especially as men are getting older, is they'll have to go to the bathroom more frequently. They can't wait as long in between going to the bathroom. They'll wake up more at night, or they might have trouble when they're emptying out all the way, or feel like they have to go again when they get done.
I bet a lot of people too feel like it's just a normal part of aging, and I've just got to suck it up.
Right. And that's why it's important to get checked out, because it could be a benign process, there could be prostate cancer, so you kind of have to get evaluated to make sure. And it's not just a normal part of aging, it's something you have to be
And that
examined.
you can do something about it.
Exactly.
But you don't have to just live with it.
Right, exactly.
Yeah, so what are the treatment options? Now that you brought it up, how do you treat it?
Right, so some men, we do kind of watchful waiting, or just kind of see if their symptoms get worse. Other people will need medications. And then in the past, after medications, which can have some side effects, then your next alternative was surgery, where you didn't need to be put to sleep, you'd have to be in the hospital a couple of days, and there are definitely some risks with that. But now we have this new kind of minimally invasive procedure that can be a lot, it can have more benefits than the past.
Is that the UroLift? Is that what you're talking about?
Yes, I'm
what
talking
is the
about
UroLift? I heard about that.
So this is a new procedure. It was approved in 2013. We're the only people in the area that are doing it. So there's only select kind of areas across the country that are doing this procedure. So you have to go to like Chicago or Dallas. So we're the first people in Omaha to do it. It's an outpatient procedure, so it's not a surgery. You're not put to sleep for it. You're in the office, you have the procedure done, and you can kind of get immediate results.
Yeah, walk us through this.
So the prostate sits around the urethra, or the tube that urine comes from, and as men get older, you can see there's BPH, or enlargement of the prostate. And what the procedure does is there's a special device with a camera that goes in the prostate, and it deploys a suture, and that's going to extend and push the prostate to the side. It's going to deploy the suture, and then it's going to lock into place.
Oh, and so it keeps it that way.
It keeps it on the capsule of the prostate, and then you're going to reposition and lock it on the inside. And that's going to open up the urethra and help you empty out better and improve those symptoms that men are having when they're going to the bathroom frequently, urgently, and waking up at night.
This is a long-term solution?
Absolutely. So most times people come to the office, and after 2 weeks they've recovered and they're feeling better immediately. They don't have the risk of bleeding. They don't have the hospital stay. They're able to get back to work quicker and faster. So it's a permanent solution.
And when you talk about minimally invasive, those tools are pretty small. So that's how you're able to gain access to put those sutures in. And is this something that insurance covers?
Absolutely. So Medicare will cover. Some insurance programs do cover the procedure, but we always kind of check everybody out ahead of time to make sure that you get coverage before you go through and have the procedure performed.
Is there a better candidate for UroLift compared to the other traditional treatments you were talking about earlier?
Yeah, and that's important to kind of come in to get evaluated. So the prostate can't be too large. If people have prostates greater than 80 grams, it's not recommended. And if you have an enlarged median lobe, you might not be a candidate. So you need to come in and have an exam and make sure
we
you're
don't
the
know
right
that about
person for it.
ourselves.
Right. You're not
That's
going to be able to tell until you can.
But yeah, just think about how many people out there, and I know guys, older gentlemen in my life that say, yeah, I'm getting older now, got to go to the bathroom more frequently, but it doesn't have to be that way.
No, it doesn't have to be that way. And there's lots of treatments out there, and we have this, and it's new, and it's great, and people heal very quickly, and we've had really good success so far.
And you're getting back out. If it's golf or whatever you want to do, you don't
Absolutely.
have the downtime.
Because as you know, on golf courses, they only have the porta potties about every 3 holes.
Exactly.
So
my point is, if you had some elaborate surgery years ago, your downtime, I mean, it takes a while to get back to life, but not with this.
Not with this. And most patients don't go home with a catheter. So the previous, you'd have a catheter for a couple of days to a week, and it was very uncomfortable. So this has improved that dramatically.
And so for men out there that may have some symptoms, should they just give you guys a call at the clinic to set up maybe a consult?
Absolutely, yeah. You can look us up on the website at Adult and Pediatric Urology and Urogynecology.com, and you can check out the UroLift website as well.
At least to get it checked out.
Yeah,
2 phone numbers here. So we've got the Omaha Clinic and the Council Bluffs Clinic, and so jot down the number for that clinic that's nearest you. And in this case, it's not something, or is it, where my general physician has to refer me to you? Can the patients just take this step themselves?
Yeah, I mean, you can talk to your general physician about it, but by all means, you can call us and get set up for a consultation, no problem.
And you know, a lot of women watching now, they've got the guys in their life, their husbands who wouldn't do this on their own, so maybe they could make the call and get that ball rolling.
Absolutely. That's the major reason guys come in is because their wife brings them and their significant other does.
A lot more wives picking up the phone than the men probably.
I'm one of those wives, and that's the only reason my husband would never go to the doctor, but I say, I love you, I want to take care of you, let's do this together, and then eventually he says thanks. So maybe you're in the same boat. Thank you for joining us today.
Yeah, thanks so much.
Good information.
Nice to meet you.
All right, still ahead.